Hi everybody, my name's Cherry. I'm a dentist currently working in paediatric dentistry at the Royal London Dental Hospital. It's great to be here at the National Health Careers Conference. It would be great if you could share your thoughts on the hashtag Health Careers Live. So a little bit about me. I graduated in 2014 from Manchester Dental School following 5 years of training, which culminated in a bachelor's degree in dental surgery. I then completed a year of dental foundation training, which is mandatory in the southwest region of London, and moved around a little as I was keen on doing some hospital-based jobs in oral and maxillofacial surgery. I also worked as a community dentist before settling in my current hospital job, working with children up to the age of 16. Where I work, we provide a variety of treatments chairside, but we also treat a number of children who are unable to cope with treatments in the chair under general anaesthetic. So why did I choose to become a dentist? I think for someone applying to dentistry, it may be very hard to fully appreciate the vocation until you're a qualified dentist. So for me, the most important parts that about dentistry is that it's a very hands-on profession. We're essentially performing very delicate surgery in a confined space in the mouth. So it's an excellent profession for those of us who enjoy working with our hands, particularly if you are someone who loves playing an instrument, making or building things, drawing or sewing, or playing certain sports that requires good hand-eye coordination, just to name a few. So if you are those kind of people, then you will most likely find this job very rewarding. And not only is it a highly skilled profession, it is also highly respected, and you're able to build a strong rapport and relationship with your patients over a long period, which is a part that I enjoy the most, because I get to see the kids grow and develop. And for many of us as clinicians, we often thrive on personal development. And I feel dentistry is a lifelong learning experience where, as treatments and technologies evolve, we are constantly improving and gaining new skills to provide better care to our patients. And beyond the clinical dentistry, there are many opportunities which will allow you to go into research, teaching and education, as well as management. And last but not least, dentistry is a job that does allow you greater flexibility in deciding your own working hours and working days. So as with any other jobs, some of us, we may wish to work full-time, while others part-time. And the advantage of being a dentist is that you can choose when you work. So whether that's early mornings, afternoons, evenings, or certain weekdays, or even at the weekends, should you wish. So what exactly is dentistry and the allied dental professions? Well, if we focus on the teeth alone, we'll be thinking of dentistry as fillings, crowns, bridges, dentures, extractions, and then sometimes also implants and braces. But beyond relieving pain and restoring teeth, if we look at the more holistic picture, we can significantly improve people's lives by restoring their smiles, their confidence, and their ability to eat and speak. We also look after the rest of the mouth, the jaw and the surrounding soft tissues and structures inside and outside of the mouth, and the craniofacial areas. And to do this, we work very closely with our dental nurses who directly assist with the care while the patient is in the chair, and other allied dental professionals such as dental therapists and hygienists, as well as technicians. We also regularly liaise with other medical professionals. So that would include general medical practitioners, hospital specialists, psychologists, dietitians, and then speech and language therapists as well. So to give you an idea of the types of dentists we have, and also types of dental professionals, we have essentially 13 different dental specialties here in the UK that are recognised by the General Dental Council. So while the majority of us may choose to work as general dentists, some of us will actually want to specialise, and these specialties will include The more clinical ones, which are prosthodontics, oral surgery, oral medicine, orthodontics, pediatric dentistry, periodontics, endodontics, restorative dentistry, and special care dentistry. And also behind the scenes, we also have dental public health, oral microbiology, oral and maxillofacial pathology, and oral and maxillofacial radiology. And any of these dentists may work with a dental therapist or dental hygienist who will have a shorter course of training and thus perform a slightly more limited range of dental treatments, such as treatments of baby teeth, certain treatments of adult teeth, and then also dental cleaning, as we all know. And they're the ones who are going to help us to provide care to our patients. And finally, a large part of dentistry will rely on our dental laboratory technicians, who will get to know very well and will get to know their work very well as well. And they're very highly skilled at making very realistic looking crowns, bridges, and dentures. So as a qualified dentist or a dental professional, we can choose to work within the NHS or privately, and also in a number of or a combination of settings, such as general practice, which is considered primary care, community dental services, or in a hospital secondary care setting where specialist and multidisciplinary care can be provided. And you can find a range of professionals with different training and experiences working together in each of these settings. So the training in the UK encompasses 5 years of undergraduate training and a further year of dental foundation training, which is mandatory, which allows you to fully register as a dentist with the General Dental Council. And at this point, you can choose to go into general practice, or you may wish to explore further training and become a specialist or a consultant. You will be training within a hospital setting, after which you may choose to work in hospitals or privately in general practice or in a combination of settings, which is often the case. And some of us may also be attracted to working a community setting, and these usually consist of dental officers and specialists working alongside therapists and hygienists. This is usually aimed to provide care for children and adults who may be very anxious or uncooperative. Many of them have complex medical or social backgrounds and needs. And while we provide care in our clinics, at the majority of the time, we also work in mobile units, and we sometimes provide domiciliary care to patients who are unable to leave their house. So one of the most important questions when you're choosing a career might be, what is the earning potential as a dentist? Well, dentistry is one of the highest paid graduate jobs in the country. And bear in mind that your first year is a training year. We will be starting off with approximately £33,000 to £34,000. And this can ramp up quite quickly depending on the path you choose, whether it's hospital dentistry or general practice, and whether it's fully NHS, partly private, or fully private. And more importantly, obviously, it depends on the lifestyle you want to lead outside of dentistry. So as a dentist working in general practice, your earning will vary very greatly. But this is in general around £50,000 to £110,000. And a wholly private dentist can earn more than £140,000 per year. So working in the private sector can give you better financial rewards, much higher than the NHS earnings, but it may also mean that you'll be dealing with more complex and demanding patients. Working whilst training hospital settings, on the other hand, your salary can range between £40,000 to £50,000, and then up to £58,000 as a specialty trainee. And hospital consultants working full-time in the NHS can earn around £100,000, and this will vary again depending on years of seniority and experience. And finally, salaried dentists working in community dental services earn somewhere between £44,000 and up to £96,000. So finally, where is the best place to work as a dentist? Well, personally, For the level of education and for the type of people you'll be treating, I think work in the UK will give you some of the best training and a breadth of experience, and will allow you to come into contact with people from various socioeconomic groups. And you'll find some who have been able to afford excellent dentistry from the very beginning, while others who you'll need to be doing a lot of work on. If you want experience of dentistry, and if you want to treat people and help people, working in the UK is a great place. But I think often our decision making will be based on personal and family circumstances. So I'd say work where you're happy, and I wish you the best of luck in your careers.